This podcast is for informational and educational purposes only and is not a substitute for professional mental health therapy, diagnosis, or treatment. The topics discussed on this podcast are intended to offer general insights and support, but are not personalized to any individual's unique mental health needs. If you have specific concerns about your mental health, please seek guidance from a qualified mental health professional or licensed therapist. Your mental well-being is important, and only a trained professional can provide tailored advice and care. If you are currently experiencing a mental health crisis, please call 988, the Suicide and Crisis Lifeline, 911, or go to your nearest emergency room immediately. Do not wait for a future appointment or podcast episode. Help is available right now. Remember, you are not alone, and support is always available.
Pull up a chair, take a breath, let's talk. Life gets messy and that's no shock. Honest words, no sugarcoat, just heat. Welcome to Holly's world, the hot seat. Hot seat.
Hello everyone, welcome back to the Hot Seat with Holly Meginniss. Today we're going to be a little bit more professional. I dressed as if I were going to my office, or if I had an office. I actually work from home, so it's kind of cool that way. But check this out. I have a sticker. That's my little mini me. That's what I call it, my little mini me. I think that's really cool. Thank you, Kurt, for doing that. It looks very cute. All right, so we're going to talk about a term that a lot of people are hearing bounced around a lot. Neurodivergence. But what does that mean? Does it, are you neurodivergent? Are you neurotypical? So let's talk a little bit about it. We're going to talk about what neurodivergence is in general, and then we're going to focus on two specific things in this month's episode. The first one, which is this episode, is autism. We're going to talk about what autism is, what it's not, what may be the cause. Note word may be the cause. And what definitely is not the cause, because bullshit doesn't work around here. All right, so what is neurodivergence? So the Cleveland Clinic, this really fancy place over in Cleveland, Ohio, that's very well reputable, full of scientists and all that stuff, defines it as a non-medical term that describes people whose brain develops or works differently for some reason. They have different strengths and struggles from people whose brains develop or work more typically referred to as neurotypical. Sometimes it's caused by a medical condition. It can be we'll talk a little bit more about that in a minute, or it can be just happen with no medical reason. It's a different brain. Not a black and white separation between different and normal brain functions. It's really kind of a shade of gray, that idea of a spectrum we talk about, viewed as a spectrum that people can be anywhere on depending on severity. And we will talk about that as what that looks like with autism. So here are some of the list of neurodivergent conditions. You might find yourself on one of them. Most people have heard of dyslexia. Let me trip over my words. It is reading problems. Dysgraphia are writing problems. When you look at the dyslexia, there's a lot of word turning. Sometimes words look different. Everybody's, oh, the words are backwards. No, it's very much a variety of different things. Dysgraphia is handwriting. It has nothing to do with motor skills. I know people who could put a rectal thermometer in a gnat's ass. That's how good their fine motor skills are. But they have a horrible time with their handwriting. Developmental coordination disorder, coordination issues. They are a little more they get a little more tripped than other people. And it can be just a really difficult thing. Balance, other things like that. We've all heard of Tourette syndromes. It's a tic disorder where it can be verbal, it can be physical, it can be a variety of different things. Sensory processing disorder. Somebody I love a lot has this. Very sensory sensitivity, too much light, too much sound, don't take information in very quickly, not an uncommon thing. Obsessive compulsive disorder. Those obsessive thoughts and compulsive behaviors. If you know somebody that deals with that, pretty typically it's, counting, cleaning, checking, those kind of things. They have to flip the light switch so many times. They can't walk on, when we were little kids, don't step on the crack, it'll break your mama's back. Well, they won't, because something bad will happen. Somebody they love will get hurt. Somebody they care about will get sick, something like that. Hyperlexia, this is a funny one. Hyperlexia, this is one I hadn't really heard of, but I did some research on. It's advanced reading. I think I may have had that. I was reading like really big textbooks when I was very young, and it was quite interesting. Synesthesia, which is cross senses. You're seeing things and it sets off your hearing or whatnot. Autism spectrum disorder. Social interaction is the primary issue with autism. And dyscalculia, which is math, struggles with numbers, math, that sort of thing. So like I said, there are a variety of neurodivergent conditions, but we're going to focus on this in this episode specifically on autism. It's really important that you have facts about that. You may wonder if you're autistic, if your child's autistic, if somebody in your family is autistic. And we'll also talk about the raise in numbers for autism. Why are we getting so many more diagnoses? So, I have a prop here. In my world, there is one book that we work with all the time, and it's called The Diagnostic and The Diagnostic and Statistical Manual for Mental Disorders, or the DSM. There have been several versions of it. This is the most recent version. It's called the DSM-5 TR. I forgot to look up what TR stands for. I know what it stands for, but it is not coming to me right at the moment. This is the first revision of the DSM-5. So this is the most current information that is available. All of these, and I have it tabbed. Isn't that cool? All of these yellow tabs here are neurocognitive issues. And right here is autism, and right here is ADHD. Most of the information I'm about to share with you has come from this book. And these are my hillbilly tabs because this gets me to things I use quite often when I'm doing diagnostic work in my job. So most of the information comes from here. If you have a therapist or you have a psychiatrist or a psychologist, this is what they use to do diagnostic, to do all kinds of different things. Now, I'm not going to give you every single diagnostic criteria for it, because I don't want you to self-diagnose. You cannot self-diagnose. It's like if you ever take a psych class, especially if you're an undergraduate, they tell you don't go home and diagnose yourself or anybody else. But we're going to talk about what it is. So the DSM-5 TR states persistent deficits in social communication and social interaction across multiple contexts, including deficits on social emotional reciprocity, including struggles with back and forth conversations, reduced sharing of interests, and unable to initiate or respond to social interactions. What does that mean? So typically, you might deal with someone, or you can have a conversation with someone you care about. They're able to pick up on what you're trying to lay down, so to speak. With autism, that is difficult. And like I said, it's on a spectrum. So it can be, they might be a little off, they might be a little unsure of what to say or what to do, versus they're not going to say anything. They're in their own world. They are just not there. They might repeat what you're saying. Those kind of things. Problems with nonverbal communications used in social interaction. Their verbal and their nonverbal communications, such as their body language and what they're saying, don't match. Eye contact and body language. They don't make a lot of eye contact a lot of times. You'll see that they'll be looking around. They'll be looking at something else. You know, it's normal for us to look around when we're talking to somebody. It's not unusual. So, but when you've got somebody who cannot make eye contact with you and it makes them very uncomfortable to try to do that, that's a good indication of autism. Not understanding or use of gestures. If you say, go over there, they may not understand what that means. What's there? Or if you make a face like this, they don't get that. That's a body language and a gesture they don't understand. So, lack of facial expression and nonverbal communication. In my world, we call that a flat affect. You might be with somebody and you might be at a show with somebody or watching a movie with somebody who's really, everybody's laughing and enjoying it and having a good time, but you're with somebody who doesn't. It doesn't mean that they're not enjoying it. They just don't have that skill. Difficulty in developing, maintaining, and understanding relationships. That's a big piece of this. They don't know how to make friends. They don't know how to say, I love you, in some degrees of autism. They don't know how to start a conversation. They rarely will, depending on what level they're in. Or they may not respond in a way that you would expect them to respond in a relationship. So there's a little bit of patience that is needed in that regard. They cannot change their behavior to read the room. So they walk in and they might say something that's just like, and depending on the degree, this is kind of a higher level of somebody with autism, but they might walk into a room and see somebody who might be a little heavy and look at them and go, you're fat. And it's like, everybody's looking around like, oh my God, they don't know that they did something that was completely not okay. But they didn't mean any harm by it. They're just stating what they see. And that can be really difficult, especially if it's a loved one and you're with them. It's like, oh crap. You kind of want to go over and, okay. That's just not what they do. They have a really hard time, especially in children, with imaginative play or playing friends or making friends. In early childhood, like birth to 3, we will see children do what they call parallel play. They'll play next to each other. They won't play with each other. But as they get older and they start to have social interaction, they are able to develop that. Folks with autism don't. They are very comfortable and quaint, just doing their own thing. And they're okay with it, and they don't really need to have those interests in others. Repetitive, restrictive patterns of behavior. We'll see things like repetitive motor movements. Sometimes in higher levels of autism, it's the hands, the flapping of the hands, things like that. You'll see them line things up, like they'll line things up in a certain way. They'll have what's called echolalia. Someone I love very much has a high level of autism, and one of the symptoms of their autism is echolalia. And when I'm around, they do it a lot. And it's funny, and it doesn't bother me. I'm so used to it, but they will do that. They will repeat what you're saying. They're not trying to mock. They're just doing that because that's part of their autism. Extreme distress at small changes. Now, given the fact that human beings hate change as it is, this is extreme. This is if you move, we were talking about them lining things up a certain way by color, by height, by type of, like matchbox cars, by type of vehicle, and you go over and move that car, you better be ready for World War III. They are going to lose their shit on you. You do not do that. That's why it's really important with folks who have autism to warn them ahead of time. And sometimes that can't be helped. But in the spectrum, from level 1 to level 3, level 1, they'll be really uncomfortable. They'll need to kind of work it out in their head, and eventually they'll be okay with it. But in level 3, you don't do it, because it will be very disruptive to them, and you have to be very careful. Like I said, life happens, and usually those kids work with what's called an ABA therapist, who help them learn these skills so that they don't freak out so much about change. Highly restricted, fixated interests that are abnormally intense. I can give you an example. As I said, someone I love very much has autism, and this person loves flags. And I'm not talking about, this kid can tell you flags of just about every country in the world. And I'm not joking. And has the full-size flags. I have bought this kiddo a full-size flag of my home state, which is Indiana. Just a really intense interest in that. Another thing that this particular person is interested in is music and movement and dance. This child, I keep telling this child's grandmother, who happens to be my best friend, that this kid needs to be put behind a drum set, because I think he would be a savant at drumming. That means if someone is a savant, is an autistic savant, that means they have an immense talent at one thing. They may not be able to do other things, but boy, you do these things. You've probably seen people who, the movie Rain Man, for those of you who remember it. He was a savant. He could count. He could figure out things like that. Sometimes there's people who can play music. They're amazing pianists and things like that. So I've mentioned a little bit about how autism spectrum disorder is defined. And it used to be either autism or Asperger's syndrome, which is considered high functioning autism. First thing to know is we don't use that anymore. Autism is referred to on 3 levels, 1, 2, and 3, obviously. Level 1 is requiring support. That's how we define it. These are folks who have some deficits in social communication. They may struggle with choosing how to respond to something. They may know that there is a response they need, but they're really not sure what that looks like. They may struggle with social interaction or initiating social interaction. Dating with level 1 autism is challenging, because you want to talk to somebody, but you're not sure how to do it. And then you're really afraid you're going to step into a pile of crap if you're not careful. And that's a big struggle for them. Atypical or unsuccessful responses to social behaviors of others. That means, let's say, I'm trying to think, I've got a movie that's coming in my head and it's not coming quickly, so we'll kind of move past that, okay, if it pops in. I know there's a movie, if you've ever seen the movie The Big Chill, there's a young lady in that movie named Meg Tilly, and she is the girlfriend of the character who passed away that brought all of these characters together. And there's a sequence in that movie where they're really talking about some deep stuff. And it's very intense and it's very sad. And she busts out laughing. And everybody just kind of looks around. And then one of the characters kind of is very kind to her. But that's a very autistic behavior. When I think about it, that character probably was autistic or was designed to be a high-functioning autistic person. It's not uncommon for that to happen for somebody who is a level 1 autism. Issues with switching between activities. They don't want to quit. They don't want to stop doing what they're doing. They don't want to go do this. They just want to keep working on that. They want to keep working on that. They want to keep working on that. And it's time to go have dinner, or it's time to go do other things. And that can be really difficult. Or they're building something, just really not, they'll do it, but it's difficult. Problems of organization, Problems of organization and planning hamper independence. They really struggle with the idea of planning and organizing. They want to go on a vacation. What are they going to do? How do you get ready to go on a vacation? Are you going to drive? Are you going to fly? Are you going to rent a car? Are you going to have somebody on the other side pick you up? All of the things that we put into, what are you going to do on that vacation? Are you going to go visit museums? Are you going to go see friends? Are you going to go to an amusement park? Are you going to do this? Someone with level 1 autism is absolutely crippled by that. It takes so much for them to be able to even think about doing that. And that doesn't allow them to be as independent as they want to be sometimes. They're having friends over for dinner, or they want to have friends over for dinner, but they're really afraid to do that because that requires planning. How is everybody going to sit? How is everybody going to, what are we going to have? What ingredients do we need? All of those kind of things. So they usually need help with something like that. It is often, level 1 autism is usually referred to as higher functioning autism. So now we understand that level 1 is somebody you may not even know. You meet somebody and, they may seem a little different, but you're not quite sure why. That probably somebody who is dealing with high functioning autism. So let's talk about level 2, which is not as easy as, no autism is easy, but not as higher functioning as level 1, but not as disabled as level 3, which we will talk about. Level 2 is really marked deficits in communication, in social communication. They just don't really know how to have a conversation with anybody. They may speak in short sentences. They may answer your question, they're not going to elaborate. If you ask them to explain to you why, like the person I love so much, if I ask why they like flags so much, that's not a conversation we're going to have. That's just not. But if I say, what's your favorite one? They'll show me. Or show me your 3 favorite ones. They can do that. Social impairments, even with supports in place. Even if they have a caregiver that's with them, they still struggle with making decisions and how to behave and not getting, even if they're tired or they're hungry or something like that, the things that might make you or I a little cranky, they don't know. They don't have it. They don't have it in them to be able to handle that, even though there's somebody there to support them with it. Reduced or abnormal responses to social interactions. You may talk to them and they're like, not even paying, it seems like they're not paying attention. That's not uncommon. They might be, just totally doing something else and you have to literally get in front of them and say, hi, or may I join you? Or something like that to interact with them in kind of parallel play, so to speak. Like I said, they speak in simple sentences and they're not going to be, nobody with level 2 autism is going to be able to recite the Gettysburg Address unless they have a savant talent. And that would be something very specific and they'd have to be interested in it. Like I said, limited to special interests. They can probably, the kiddo that I love so much can give me all this information about these flags, but can't tell me about their school day or how school's been going. They have markedly odd nonverbal communication. They might fidget a lot. They might have, like I said, the way flapping hands or the, rubbing hands. They could do all kinds of different things, pulling at something. That's a lot of what you see there. These are folks that are probably going to need some kind of support throughout their life. They may not live independently. They may be okay in a group home where they have trained staff to be able to deal with things. They can usually do things on their own, and when you ask them to do it and know how to approach them appropriately, they will. You can correct behavior. But these are usually folks that are not going to live completely independent, whereas a level 1 autistic person could. So let's talk about level 3. Inflexibility of behavior. Difficulty with change, restricted and or repetitive behaviors frequently enough to be obvious to the casual observer. Like we were saying, you might see the hands going. You might see them pacing. You might see them jumping, a variety of different things. You know there is something different about that person. It's not something to be afraid of. It's not something to hold your children away from. It's not contagious. But they're different. And that's who they are. Difference makes the world go round, you know. Let's talk about level 3 autism. And this is someone who is requiring substantial support. Severe deficits in social communication to the point where they may not speak at all, or they speak 1 or 2 words at you. There aren't really sentences being formed. Very limited initiation of social interaction, minimal response to social overtures of others. You may go and, if you're somebody in this person in a level 3's orbit, you might be able to hug them, but more likely than not, they're not going to hug you back. You're not going to hear I love you out of a level 3 autistic person. They may communicate in different ways, such as hitting something or, hopefully not yelling, but it wouldn't be uncommon for that to be the case. Few words of intelligible speech. Like I said, it is not uncommon for a level 3 autistic person to not be able to speak. Or they can say their name, or they can say mom or dad or brother, their brother or sister's name. But their communication skills are exceptionally limited. They rarely initiate social interaction. Doesn't happen. It's just not in their wheelhouse. It's not going to happen. Extreme difficulty with change. They don't do it well. It's always, I've worked with families who have had level 3 autistic folks in their family, and it's really hard for them to deal with them not being, like if there's an illness, going to the hospital. It's not unusual for somebody to have to be sedated if they're in the hospital because it's so scary. They don't know what's going on. They don't understand what's going on. And it's not because they're trying to be difficult. It's because they have autism. So what causes autism? There is no single known cause for autism. But it's complex and their symptoms may vary. There is genetics. If there is somebody in the family who has had autism, there is a good chance that there will be other members of the family. It doesn't have to be a direct descendant, so to speak. It could be an uncle or a cousin or something like that. It doesn't have to be that immediate family of origin. Some may have genetic mutations that raise the risk. Some genes may affect the way the brain develops or brain cells communicate. Other genes may affect severity. There could be some environmental factors. And when we say that, we mean the ideas of things like viral infections, medications. This is the big one. Complications during pregnancy. And meaning primarily premature birth. The person that I love that has could be, I would say, level 2 autism, was born at 25 weeks gestation. 3 months early. He was just a little bit bigger than my hand. when he was born. But he was a fighter. And now he's a teenager who is just adored by everybody in the family. Let's talk about what doesn't cause autism. Vaccines do not cause autism. They never have, and they never will. Autism is a neurodevelopmental issue. It happens in the building of the brain. It is not caused by a vaccine. You cannot have a brain degrade like that. There are some rare genetic disorders where that can happen, but it's not even called autism at that point. Not getting vaccinations, though, could kill a child or leave them with a time bomb in their head. There's one that people are starting to learn about now because we've had so many outbreaks of measles. It's called measles encephalitis. And if you deal with measles encephalitis, if your child gets it, and here's the thing, they can get it later on after they've had the measles. If they have measles encephalitis, they're going to die. There is no cure for that. It will kill you. Acetaminophen, Tylenol. It will not cause autism. It is the safest pain reliever for pregnant women. I got sick with a very bad cold and virus with both of my pregnancies, and Tylenol was where it was. However, if you take something like Motrin or Advil or Aleve, at a certain stage in your pregnancy, you could cause damage to your child. Your doctor will tell you that. If you're expecting a baby, talk to your doctor. They will explain to you. But it is not Tylenol. That is bullshit of the highest order. There's been an increase in diagnostic. Why? It's not clear. If this is due to because we have much better ways to diagnose it now, or a real increase in the number of kids with it, or both. Boys are 4 times more likely to be diagnosed than girls because the symptoms are different in girls. They're different brains. It's possible that girls are going undiagnosed, and that is very true. Family history. Like I said, if there's a family history of autism, it's not unusual for that to be part of the situation, or other conditions such as Fragile X syndrome, tuberous sclerosis, Rett syndrome, which is an illness that happens in girls, an early birth, like we said, born before 26 weeks, or how old the parent was at the age of conception, which also raises the issue for things like schizophrenia, depending on how old dad was, Down syndrome, depending on how old mom was. It's not that you can't have these things happen, but it is not vaccines, and it's not acetaminophen. Which brings me to my favorite time and yours, the no bullshit corner. So I want to stress something really important here. The information that I have just shared with you has come from Johns Hopkins University, the Cleveland Clinic, the Mayo Clinic, the American Psychiatric Association, who publishes that book I showed you. These are well-researched protocols. These are peer-reviewed research, which means other doctors have reviewed doctors' work. Not a bullshit idea by a non-expert with no training or understanding of this disorder. Y'all know who I'm talking about. And if you don't, he's had a brain worm, he likes to swim in sewage with his grandkids, and he thinks he knows everything. And he's really big on those vaccines causing autism. Robert F. Kennedy Jr. is not a medical professional. He has no training and no experience as to what this is. Do not listen to him. If you have concerns or questions about autism, talk to your primary care provider, talk to a therapist, talk to a psychiatrist, but do not follow something that is not well researched, that is not proven over and over again by providers. I know I'm getting passionate about this, but kids don't deserve to be denied healthy opportunities because people believe in fake science. It's important to remember, like I just said, well-researched information, if you want accurate, well-researched information to make decisions about your health or your family's health from the CDC or other government entities that are run by experts. And right now, the CDC, that are run by experts in their field, and there has to be a change in our current political regime in order to have those things happen again. The CDC used to be the cream of the crop of getting that information. SAMHSA, which is about is the mental health arm of that. The National Health Organization. It's all crap now. Do you want it to fixed? Do you want it to be changed? We talked about in our last show, V for Vendetta and the character V. And I mentioned in the no bullshit corner for that one, you have 1 year. If you want to make a difference, you have 1 year. We may not be electing a president, but we are electing congressmen and senators. And they need to remember who their bosses truly are. They work for us, and we have the opportunity to fire them. And I want to remind you what I always say at the end of every show, and still don't have it memorized, so I apologize that I have to read it. The only thing you have control of in your life is you. Don't ever give that to anyone else with the idea of them making you happy, because that's your job and nobody else's. Next show, we're going to focus on ADHD, and I got a very special guest. I'm very excited, and I look forward to doing it, and I'll see you next time.
If you are currently experiencing a mental health crisis, please call 988, the Suicide and Crisis Lifeline, 911, or go to your nearest emergency room immediately. Do not wait for a future appointment or podcast episode. Help is available right now. Remember, you are not alone, and support is always available.
Welcome to Holly's world, the high